Hi, so this video will be about pelvic stability and hip range of motion assessments. These assessments are important because they help to assess glute max flexibility and pelvic stability, which is essential for functional movements involving the lower body. Proper pelvic position is crucial for accurate assessment, especially in the Thomas test. So for muscle attachments, the gluteus maximus and the hip flexors, which originate from the lumbar spine and insert into the femur, and the rectus femoris starts at the pelvis and attaches at the patella. Functions are the gluteus maximus, it helps to stabilize the hip and pelvis, especially in movements like squats, and the hip flexors facilitate hip flexion for lower body mobility in various sports. Joint actions include hip flexion, which is required for deep squatting or high knee positions, and pelvic stability for alignment and balance, especially in single leg activities and load-bearing activities. So the significance of each assessment, including the Thomas test, is that it validates hip flexor length and potential compensations due to tightness in the gluteal or hip muscles. Comparing to sport-specific normative data allows for better understanding of an athlete's readiness or need for improvement in flexibility or stability. Now we'll be talking about the bilateral hip and knee flexion. So this assessment, we focus on the hip and knee joints. This movement requires coordinated actions of the hip flexors and quadriceps with balanced range of motion, which is great for athletic performance. So start by lying down with both legs extended, lie supine, lift both legs up, bending at the hip and knee until maximum flexion is reached to the chest line. Hold the position for clear measurement. Then, using an inclinometer or app at the top of the thigh near the hip joint, be sure to have a flat pelvis to avoid compensatory tilt. This is essential to keeping the pelvis neutral because any rotation or tilting could interfere with the measurement or cause compensatory actions. Some errors to avoid are making sure the pelvis remains level and does not shift or lift off the surface to avoid inaccurate measurements and muscle imbalances. Now for quantification and analysis, here my results for the left were 128 degrees and for the right 127 degrees with an asymmetry index of 0.63, which is pretty minimal. These values fall within the normative range of 120 through 135 degrees according to Plinsky, which is great for maintaining even flexibility and performance across both sides. The asymmetry cutoff range is between 0 to 10%, so being between this range is good and it will be in a normative range. However, there should be balanced flexibility in both legs. With minimal asymmetry, this indicates well-balanced hip and knee flexion, which can support consistent athletic movements.